If you were diabetic, how far would you go to save a limb? Well, we're going to answer that question in this video. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and this one was just too juicy to pass up on, so I wanted to make sure I shared this information. And it has to do with a treatment that we generally don't use, but is pretty well accepted to be effective for non-healing wounds. And I remember early in my days of working as a histologist in a hospital, we would take specimens that had come out of surgery, and I would help our job was to help the pathologist to make slides out of them and take a look at them. And there was one that came out of the freezer, and it was a below limb amputation, so a BKA, and you can imagine chunk this side. Well, he opened it up, and there were maggots in there. And my first thought was, that can't be good. And the second thought was, when I discussed it with the pathologist, he had said that that is not that uncommon, that they use maggots to try to save the limb. While that sounds gross, there's a lot of reason for that. We've heard that maggots only eat dead tissue, which is true, but in this particular study, they actually looked at the ability of maggot extrusions to actually help develop brand new blood vessels and help heal diabetic wound ulcers. Ulcer wounds, non-healing wounds. And sure enough, they found that when this was not done on patients, this was done essentially in the lab, but they found that not just the maggots themselves, but just the extrusions from the maggots, the secretions that they used, were able to improve, create brand new blood flow to that wounded tissue, which is phenomenal. I mean, it sounds like a really not something you want to sign up for, but if we've made the choices and it's a little too late for lifestyle changes to save that limb, you might want to consider using or discussing with your doctors about using maggot treatment. So there's initials for the actual treatment. I can't remember what they are right now, but again, well accepted treatment, even though it seems like it's a little gross and unconventional, but there's not really a downside to that other than the sensation of having little creepy crawlers on your legs or whatever area of the body you're trying to heal. As always, I will put the link to this particular study in the comments section, and make sure you like this video, share it with somebody who you think needs this information, or you just want to scare if they're not making the right choices to improve their diabetes, and subscribe to the channel.